people are reminded about this power they have to choose their own destiny. Some people come out of these sessions as participants and say that, 1 6-hour experience with psilocybin is like 1,000 hours of therapy. My therapeutic research with psychedelics has primarily used psilocybin, which is the agent in magic mushrooms. The dose we now give to patients is anywhere from 30 milligrams to 40 milligrams, which Terence McKenna, who's the famous psychedelic bard, would refer to repeatedly as the heroic dose. If a microdose is over here and a recreational dose is over here, we're way over here. When someone comes in for the day of their psychedelic session, they've already spent several hours with us on previous days preparing for the experience, developing that rapport. We know that all drugs are in part shaped by the context in which they're given, but for the psychedelic substances, that's particularly more so. So when you provide it in more of a warm, welcoming situation, you tend to get more meaningful reactions to the substance. When the experience unfolds, the person is going to lay down, wear eye shades and headphones through which music is played. So the idea is kind of get out of your normal, everyday, discursive, analyzing intellect. We really just encourage them to trust, let go, and be open. Trust the overall process. Going into this type of treatment is not easy at all. Trust yourself that you're robust. You're going to get through this experience. Let go. What does let go mean? Let go means whatever your preconceived notions of what this experience might be or what experience you should have, don't let that get in the way for the experience that you will have. Don't try to control it. And be open. No matter where this takes you, go there. Whatever the experience is, take the orientation of, this is what I need to deal with. The range of experiences are just so broad. You can swing from a terrifying experience to this beatific, sort of like most amazing experience of your life. Some people could feel like they've reached the end of reality, this kind of plane of existence. Others say that they can feel the suffering across the entire planet, sort of having this sort of experience of universal empathy. It's all welcome. The laughter, the tears, everything in between. That's exactly what this process is for. So the integration phase is where we're discussing the experience with them. And the themes that come up are so varied. One of the aspects you could call revealed truth. And I call these duh moments. These are experiences where people will feel like they've learned something at such a fundamental level. I think of examples in our work we've done with cancer patients where, oftentimes people will say, I'm allowing this to create my own suffering. The cancer hasn't killed me yet. I can still live life, but I'm letting it do this to me. They knew it up here. They could tell you the words, but now they feel it in their bones. They feel it in their heart. People are reminded about this power they have to choose their own destiny. Some people come out of these sessions as participants and say that, 1 6-hour experience with psilocybin is like 1,000 hours of therapy.